Good afternoon. Welcome to our webinar. My name is Michelle James. So this webinar is the introduction to the PErforM program. So today's webinar is the first in a three-part series on the PErforM program. Essentially what we'll be talking about today is just answering three key questions: what, why and how. So we're going to talk about what is the PErforM program and the resources that Workplace Health and Safety Queensland offer. We'll discuss a bit about why workplaces might want to implement PErforM and share some benefits that workplaces in industry have reported that have used the program. And we're just going to touch on some things to consider when you want to implement the program. And it's just to give you an idea ahead of some things that you might want to be aware of. We will cover implementing the program in a lot more detail throughout the series. So just to let you know, we do plan to run the session for about 45 minutes, and then we should have some time at the end for some questions. Please feel free though to post your questions as we go, but I will be addressing them after we've covered all the material for today. So what is PErforM? Well, the term is an acronym. It stands for Participative Ergonomics for Manual Tasks. So it is a simplified manual task risk management program, and it is based on a participative ergonomics approach. So the idea of PErforM and participative ergonomics is that the worker is the expert in performing their tasks. So what PErforM does is provide a framework for assisting workers to identify and control their manual tasks risks within the workplace. As part of this program, work teams are given training about manual tasks risks, and then they participate in facilitated workshops or sessions in the workplace to generate some control ideas. Now, research has demonstrated that participative ergonomics, that whole approach, has a positive effect on decreasing risk. So it really is an internationally recommended approach for reducing musculoskeletal disorders when you look at the research and evidence. The advantages to using a participative approach where you have the workers involved in the process is that because the workers are experts on the job, they know what the problems are and they know what controls are going to work. So this is going to mean the controls will fit in with the job demands and the workplace requirements. It also gives workers a greater sense of ownership and commitment because they're using the controls that they've developed. There are some limitations around the PErforM risk assessment tool. It is a simplified approach, and I guess there's a couple of things I just want to highlight with simplifying something. For example, it may not be suitable for complex manual tasks. For example, tasks involving handling of people. So in these cases, you would probably want to use other ergonomic assessment tools, or maybe consider engaging an expert in ergonomics to help you assess those and develop those controls. However, having said that, in industry sectors that are commonly associated with people handling, like community services and health, we have seen these sectors use the PErforM program really quite successfully, but they're focusing on their non-clinical tasks, for example, in the housekeeping, laundry, food services areas. The other limitation I want to highlight is that the risk assessment tool doesn't take into account the cumulative effect of a range of different manual tasks that a worker might do across their whole shift. So the PErforM risk assessment will look at one task in its entirety, and then you can assess another task. So with that in mind, you'll need to have the work teams or a facilitator who's able to make some judgments about what other tasks the worker is being exposed to with the similar risk factors throughout the shift. So if that's the case, you need to think about controls that are going to address that cumulative risk. However, despite all that, the PErforM program has still been shown to be a very effective program for workplaces in managing manual tasks risk. just a little discussion on why we're focusing on manual tasks. Just think about your organisation. What types of injury claims are you experiencing the most at your workplace? Now, when I ask this question in my PErforM workshops, the most common answer is sprains and strains. And when we look at the workers' compensation data, it shows that the biggest injury type across all industries is sprains and strains, or musculoskeletal disorders. So the biggest cause of these sprain and strains is your hazardous manual tasks. So to bring down these injuries, we do need to focus on the primary cause. And we're not just talking about manual handling, just lifting, but manual tasks, which is a whole range of tasks around pushing, pulling, holding. All these things do contribute to sprain and strain injuries. The research also shows us that mental health and chronic disease risk factors can also contribute to these injury types. So today with PErforM, we are just focused on manual tasks and, importantly, the physical risk factors only. We have a range of other resources on the Workplace Health and Safety Queensland website to help you address these other areas if they are an issue in your workplace. So it's critical to think about the true cost of these sprain and strain injuries that result from hazardous manual tasks. Sometimes a lot of workplaces will think, well, it is too expensive to manage our manual tasks. But think about the real costs. And yes, they are insured injuries, but they do influence the workers' compensation premium. So just to give you an idea of the costs around the workers' comp premium rates, just consider this example. One organisation who implemented PErforM, they had over 300 workers, they were able to reduce their workers' comp premium rate from $1.38 down to 98 cents in the 18-month period after implementing PErforM. So for them, this translated to a saving off their premium bill of over $200,000. So that's quite a significant cost saving. And of course, there are also other costs to businesses that are associated with your injuries. You might think about the retraining of replacement staff. There could be delays in production. So when you're looking at all your total injury costs, are you also accounting for these uninsured costs? And look, even without an injury claim, some workers might just take sick days rather than report their sprain or strain injury. So again, high absenteeism, that's costly, and it might also indicate that there are problems in your workplace. So look, the impact of these costs on business profitability can be enormous. Now, in addition, the last dot point there, in addition to being good for business, a key reason we want you to manage manual tasks is that it is a legal duty under the Workplace Health and Safety legislation. So we'll just quickly look at that, because I'm pretty sure most people listening today would be quite familiar with the Workplace Health and Safety legislation. So I've just got some of the key sections outlined on the slide there. On the left, we have the Act, and that requires that employers ensure health and safety. And also notice that there is a duty to consult. So employees are required to consult with their workers around health and safety matters. And also we have the regulations. So they're a little more specific. And yes, we do have a regulation on hazardous manual tasks. And we'll look at that shortly. On the right, I'm just showing you a couple of the relevant codes of practice. The hazardous manual tasks code of practice and the manual tasks involving the handling of people. So there is a lot of guidance and some tools or worksheets in those codes of practice to help workplaces manage their manual tasks. So what does the regulation say? So the hazardous manual task regulation requires, as up there on the slide, that a person who's conducting a business or undertaking must manage the risks to health and safety relating to musculoskeletal disorders or sprains and strains associated with hazardous manual tasks. So the main thing I want to point out there is see that link to Part 3.1. So what's Part 3.1 about? It is the risk management process. And let's just have a quick look at what that's about. When we talk about the risk management approach, we're talking about the ongoing process where you identify, assess, control, and review. So the point here is that this is what the regulation requires in relation to hazardous manual tasks. And you know, the PErforM program follows this process. Let's just think about a common approach to controlling manual tasks risk. In talking to industry, we've become quite aware that many workplaces often still rely on training workers in lifting techniques, talking about the lifting with a straight back and bent knees. And often that's their primary way to control the risk. Now that's really an administrative control, and so it's really not enough just to start with relying on training. You are relying on the worker's behaviour as your control here. So what does the legislation require? Well, it requires that you follow the hierarchy of control as per the risk management approach. And you do need to start off trying to eliminate the manual task or using engineering controls, redesigning tasks to minimise the risk. There's also a lot of research that shows that lifting technique training isn't terribly effective. And this is also because you're not actually changing the risk factors. For example, if I had to lift an extremely heavy object, even if I follow a safe lifting technique, I am still potentially at risk of injury. And the other point is that manual tasks are more than just lifting. So this approach wouldn't apply to managing all the other tasks that are contributing to sprain and strain injuries. And you know, in the reality of the day-to-day, you know, the layout of the workplace, work demands, think about overhead obstructions, tight spaces, it can make it really hard for workers to adopt a straight back and bent knees. If they've got, you know, an awkward load or a tight space to work in, it might not be possible for workers to follow that specific lifting technique. So we're really highlighting here that the regulation does require you start managing your manual tasks by following the risk management approach, and PErforM will help you do that. Of course, we're not saying all training is bad. You do need to provide training to workers in relation to how to perform their hazardous manual tasks, and the Code of Practice for Hazardous Manual Tasks has some guidance on what should be considered in that training. So looking at all of that, just to finish off our discussion on compliance, there are a number of different ways that organisations can choose to go about managing the risks associated with their hazardous manual tasks. And there's a few different examples up there on the slide. You know, providing that there is a system in place to ensure that consultation with the workers is happening, then it doesn't really matter which approach you follow. You can have management or your OH&S staff looking at the codes of practice, getting guidance from there, developing controls. You may need to bring in a consultant, an expert in the area to help you. And you can also use workers' job knowledge. And that bottom one there, using the workers' job knowledge, that is where PErforM sits. A lot of workplaces just tend to use a combination of the above. So PErforM is just one approach to managing hazardous manual tasks risk. It focuses on the physical risk factors, but it is optional. Let's have a look at some of the key elements of the PErforM program. All right, so PErforM is more than just a risk assessment worksheet. It is a whole program. So you can see here a model of a summary of the critical elements of the PErforM program. If you just take one thing away from today, it should be these key elements. So starting on the left, we can see worker participation, management commitment, and a site champion. So they're the critical components to the program. PErforM is different from a lot of tools because it's really about involving the workers and relevant other people in the whole process, from identifying the problem manual tasks right through to the development and the implementation of your controls. It utilises the expert knowledge that the workers have of their own tasks by getting them involved in improving their workplace. So this means that controls are more likely to be effective and to meet the operational demands of the jobs. Sometimes workplaces, you know, we've seen this, they've put resources into purchasing and implementing controls that just in the end they don't fit in with the job demands, and sadly they remain unused. Look, with PErforM, workers typically come up with simple and cost-effective solutions to many problem manual tasks. and we'll have a look at some examples later in the session. The other benefit of having the workers involved is that you get their buy-in. Now, isn't getting the workforce engaged half the battle? So workers are more likely to be committed to adopting new task procedures if they were involved in coming up with the idea, rather than just being told, look, this is, we've reviewed your job and this is the new procedure that you're going to follow, or this is the new equipment you need to use. The others in that part of the model, the others there relates to other stakeholders or people or groups who will influence or can impact any change made to the work process. So think outside the box here. This might be engineers, it could be, think about your supply chain, suppliers, manufacturers, it could be your customers, designers. You might need to look at getting in an expert to help come up with some controls. It's important that these other stakeholders are identified and involved right at the outset of the program. Now, of course, you need management commitment to run anything in your workplace. But when it comes to PErforM, this commitment would involve management supporting workers to have the time to do PErforM-related activities, things like training and risk assessments and control development. So they may not be able to do this during their regular duties. So it may require thinking about taking workers offline, or maybe trying to factor in a time when the workers can have the time to do these things. Management will also need to provide the resources to support implementation of approved controls. Now, the site champion, for want of a better word, that's just someone who's going to drive the program. So have a think about at your workplace who the best person might be, because ideally you want someone who is enthusiastic and can positively influence uptake of the program. The fat blue arrow there in the center, that just highlights some of the important components of a successful participative ergonomics intervention. And it includes things like team training. So the workers and the leaders, they need to understand some of the relevant terms. So this would be the risk factors, how to use the worksheet, how to develop controls. So they will need some training, and you can think about fitting this training in with your organisation's needs. You also need to think about communication, communicating between the workers and management at all stages of the PErforM program, and about how the implementation of controls is going. It's really important to maintain that communication. If you have workers involved in coming up with controls and they submit their ideas for approval to management, and weeks go by and they don't hear anything, they are going to lose a bit of faith in the whole program. So to maintain that trust and the confidence in the program, you do need to think about how you're going to maintain the communication. Think about tapping into existing communication systems or methods that you already have in your workplace, like meetings, maybe add it as PErforM as a standing agenda item to some meetings. Think about your notice boards or other ways that newsletters, the way you communicate in your organisation. Think about integrating the PErforM program into your current health and safety management system. So this is important. Rather than PErforM just being on the side, it's going to help it maintain its life and make it a sustained program. PErforM follows the risk management process, so that's great. You also want to think about evaluation and have a process to evaluate the success of your intervention, and think about any potential risks that have been introduced by some of the changes. This is important for sustaining the program and improving it. And it's also great information that you can report back to management. So at the end of the day, it's all about achieving control of your hazardous manual tasks and reducing the risks. But the other benefits that we've had organisations report include improving health, improvements to productivity, and boosts to their safety culture. We have some case studies on our website that show the benefits workplaces in Queensland have experienced in these areas, and we'll look at them shortly. So to support organisations to implement the PErforM program, Workplace Health and Safety Queensland have a range of PErforM resources, and these can all be found on our website. And after I talk through the resources on the slide, we'll go outside the webinar and I'll show you where it is. So you can see on the top left, there's some templates for PowerPoint presentations. So you can use these in your organisation to deliver training to your work teams or to provide an overview of the program to managers. You can tailor these to your organisation. Below that we have some, just a really brief overview. That's our frequently asked questions. And it's a useful overview just to give managers or staff just covering off the main points about the PErforM program. In the centre there, we've got two key documents for the PErforM program. And the one at the top there is the resource manual. And that's designed to assist those that are actually responsible for implementing the program. And it has a lot of practical, useful information. So it has, for example, things to consider when you're implementing the program. It has templates in the back there that can help you with planning and documenting the proposed controls and presenting those to management. So a good template that you can just write all that information in. It also has a template you can use to prepare a business case, for example, for purchasing a control. The other document there is our PErforM handbook, and that's really just the basics of PErforM. It has information on the risk factors, how the PErforM tool works, how to develop controls, and it also has the worksheets in the back. The worksheet itself is available separately on the website, and that's shown on the right. And I'll show you briefly how that works too soon. The other resource I wanted to highlight is a short film, and that's called No Sprains and Big Gains. Now we'll just go to our website. Just be a moment while I can get control and show you where I want to go on the website. Okay, so where we have come, we've just landed on the Participative Ergonomics for Manual Tasks PErforM page. So to get to this page, when you come to our website, you'll see these tabs at the top. And you need to look out for injury prevention and safety. And you can see under that, there are some headings. And hazardous manual tasks is the key heading there. And I'll just show you behind that. When you get to hazardous manual tasks, you'll be able to see down the bottom there is participative ergonomics for manual tasks. So that's PErforM. So when you're on the PErforM page, this is where you can go to get the resources. So we'll just view the PErforM resources. So these are some of the things that I've talked about. This is the manual, which is the one for people who are implementing the program. These are the very brief frequently asked questions. We have the handbook and the worksheet. These are the PowerPoint templates. And we also have these webinars, and they are stories from workplaces who have successfully implemented the program. And they're really interesting because they share how they've done it and some of the benefits that they've had. And they usually show their controls that they've implemented as well. We also have these case studies down the bottom, and they have a cost benefit in them. So it's really great to see, yes, investing in a control might require some initial cost, but in all of these case studies, we can see that the control has paid itself off in a fairly short time. So they're interesting to look at as well. The other thing on our website will be the workshops. You can book in our workshops on the website, and feel free to come along even after these sessions if you still want to get a little bit more information about the PErforM program. You are welcome to come along to our workshops. We are booked out at the moment with the workshops that are on there, but we will be putting some more on there for the later part of the year shortly. And the other thing is that we have a PErforM network. So once people have come to one of our workshops and after this webinar series, so after the last of the webinars, the participants in those webinars will be able to join the PErforM network. So the network is just made up of workplaces who are interested in implementing PErforM. Some of them, they're all at different places in the journey. Some are still at that initial planning stage, but others have become quite expert users in the program. So it's really an opportunity for people to share their learnings and experiences around implementing PErforM. Okay, so that's our resources. Now I just want to talk about the worksheet. So as I said, it's more than just filling in a worksheet, but I do want to show you how it works, because I think part of the appeal of the whole program, and this is something that employers have fed back to us, is how simple it makes assessing manual tasks. And workplaces often comment on how easy it is for workers to be able to use this simple tool. So the next few slides are just going to give you a snapshot of how that two-page worksheet works. I'm going to show you just how easy it is to use it. So in a moment, I'm going to play a video, and I won't be able to talk while it's playing, so I'll just briefly explain the task and scenario before we play the video. So this is a hazardous manual task that was identified by workers in a Queensland manufacturing organisation. So prior to getting to this stage, the workers had received some PErforM training that the organisation delivered using the resources on our website. So they had training on what the risk factors were, how to use the worksheet, and also how to develop controls. The PErforM risk assessment team in this case was made up of workers, managers, including the team leader, operational staff, and their health and safety advisor. So the task that they assessed was actually lifting a lid on this preheater box. So it's basically an enclosed box that maintains tools to a specific temperature. This task was completed about once a day, and the operators had to open the lid just to change the tools over. So they've identified this as a hazardous manual task. So when we play it, just so you don't fall off your chairs, there might be a bit of background noise. You might want to turn your volume down a little bit. Don't forget to turn it back up so that you can hear me once the video has completed. But while you're watching it, just have a think about what parts of the body you think might be affected by the task. Okay, so with that task, I'm sure everybody would agree, we could see that probably the main body parts that were affected would be the shoulders, and this is the risk assessment that the workers have come up with. So they've identified the shoulders and the lower back. And you can see then that they've rated on the left the risk factors for each of those body parts. And the main things they've come up with for the shoulders was exertion at about a 4 and awkward postures. So I know we haven't discussed the risk factors yet. That's going to be discussed in part 2 next week. But look, this is just to show you how the tool works. And I'm sure you can see that it really is a really simple format for workers to be able to have a discussion about, hey, this task is a problem. Where am I feeling the pain? Where am I feeling fatigued? And what are the risk factors that I'm feeling in those body parts? So they've come up with a control after doing their risk assessment. And I don't think I need to say much here, but they've identified the forceful exertions and awkward postures. So they've tried to reduce that by this control. So again, you might want to turn your volume down a little bit. And we'll play the video. Okay, so just having a look at that picture for a minute more. So we can see the workers have just, I guess, reduced those risk factors by putting a hinge down the middle of the lid so they can easily open the lid from the side. So to be honest, I don't think this control is quite there yet. There's probably a little bit more they can do. So let's have a look at their post-control assessment. So you can use PErforM like this. You can do an assessment once you've implemented the control and see what comes up. So you can see they focused on the same body parts, and we can see that the exertion and awkward postures have been reduced. So that's great. Long term, they could think about installing gas struts, for example, and that might reduce the exertion actually required to lift the hinged lid. So I'm sure you can see it's really a very simple tool for workers to get their head around to be able to use. Okay, I just want to highlight that quite a diverse range of industries and organisations have used the PErforM program, and you can just see a small example of some of those organisations who've been kind enough to let us use their logo up on the slide there. So you can see quite a range of organisations from health, education, community services, councils, construction, civil construction, manufacturing and mining have been able to use the PErforM program. It's also suitable for all sizes of organisations. And when you start off with, often the way the PErforM program is rolled out is an organisation won't roll it out across their whole organisation at once. It's much better to start small, and because it is focused on work teams, that can in small groups of maybe about 8 workers, that is certainly going to be suitable for smaller to medium-sized businesses. Just some data from organisations that have used the program. I just want to share with you some of their reports. Now, the Council of the City of Gold Coast, they started with the PErforM program in their city cleaning branch in about 2013, and approximately 18 months later, they reported a significant reduction in their workers' compensation claims for manual handling injuries. So you can see it was a 60% reduction. So that's a huge result for an organisation. You think about the impact that would have on their premium rate as well, so for an organisation like that. So as a result of that success, the program is being rolled out in other areas of the branch, in Gold Coast Water, and they're going to continue implementing it across council. Another organisation, CSR Limited, a national organisation, they use the PErforM tool as part of their manual handling project, and they reported after running it for 12 months a 38% reduction in their manual handling work-related compensation claims costs. So fantastic results there. And both organisations also reported improved communication and safety culture, increased productivity, and they also commented that workers were being proactive in identifying problem manual tasks. So, you know, that's the beauty of the PErforM program, is that it really provides the language and the framework for workers to start having discussions around their problem manual tasks. So bear in mind that these reductions in injuries would translate to cost savings and productivity improvements for these organisations. So now I just want to show you a couple of examples of some specific controls that have come out of the Gold Coast Council. So in their city cleaning branch, they had identified workers were using some awkward postures, and they had forced to reach items stored in the back of their cleaning trucks. So the Boilermakers made up some shelving units on the back there that utilised the vertical space. So that's greatly reduced the amount of reaching and lifting required for the workers to access chemicals that they need during their shift. So, you know, that's not a lot of money to, or resources to implement a control like that, but a great improvement to that manual task. Another example I want to share with you from the Gold Coast Council was this city bins example. So this task was also identified as part of the PErforM program. So across the City Council, they had about 700 of these garbage bins, and you can see the ones I'm talking about on the left. And they weigh 60 to 80 kilos when full at times, and they did report many sprain and strain injuries as a result of workers having to manually, lift, carry and empty these bins. So the control that they've come up with was actually providing a larger capacity bin, like a wheelie bin. And these bins can be wheeled and mechanically lifted onto a truck. So it's definitely reduced the manual handling around this task. The other benefit is that the larger bins only need to be serviced once a day instead of the usual 3 or 4 times a day, which is what the smaller bins required. And the council have reported that as a result of improving this task, they were looking at the lost time shifts around this task were 184 in 2012. Well, that's come down to just 6 in 2013. Now, when I was talking about our PErforM resources, I mentioned we have some industry case studies on the website, and I said they talk about some of the cost benefits. So this is an example of one of those. So we can see the before of this workplace. So this workplace implemented the PErforM program, and the task before was, the photo is on the right at the top. So the task was in a foundry, and we had 2 employees who had to spend 2 full days inside. This is a fettling furnace with a jackhammer and shovel to break down and remove large clumps of metal slag and brick that could weigh up to around 30 kilos. So they had to clean that all out before it was relined. So the workers did the PErforM risk assessment on this task, and not surprisingly, you can see it would have come up high in all those risk factors, certainly a lot of force, awkward postures and things like that. So it was a very, certainly a hazardous manual task. Now they've gone to quite a high level control here, but I think it's a great example of the cost benefits. So they did look at elimination, and the company agreed to trial hiring a mini type excavator. So using a remote control, and we can see the operator on the left using the remote control, they're able to, with the excavator, achieve the task mechanically, and it takes less than 2 hours. So we've had 2 workers, 2 full days down to less than 2 hours, and obviously reducing, the workers, eliminating that task for the workers. The other benefit was this excavator is able to be used at other areas in the workplace. Now let's have a look at the costs here. So the company had reported 4 musculoskeletal disorders. They range from about $40,000 to $70,000 in cost. Okay, now the control did come at quite an expense, just under $118,000 to implement this control. But just looking at the labour and maintenance savings alone, this control has paid for itself in less than a year. So that's a great outcome for this workplace. So it's a really good thing to keep in mind, the productivity benefits, and while sometimes controls, there may be an initial cost, and I'm sure from the examples you've seen, they're not always this expensive. This is quite a high level control, but even so it has paid for itself in quite a short time. So we're coming to the end of our session, and I just want to summarise what we've talked about today. So, we really highlighted why it's a good thing to manage your hazardous manual tasks. They are a big problem and costly for businesses, and the legislation does require that you manage those. But at the end of the day, it is good for business to invest in managing your manual tasks. The PErforM program is just one optional way that you might choose to help manage your manual tasks, and it will help you meet compliance under the workplace health and safety legislation. And just some key things to keep in mind when it comes to implementing the PErforM program is that it requires, or it's based on having the worker participation, and that it requires having that management commitment, and it's also about identifying a good site champion. So, as part of the webinar series, part 2, which we will be running next week, that's going to be covering the risk factors, how to use that worksheet, how to use the tool, and we'll go through a couple of practical examples showing you how to do that. More importantly, we really will be, I guess, fleshing out those risk factors so that you really have a good understanding of what they look like and how you can guide your workers and have the discussions around those risk factors at the workplace. So if you are planning on joining us next week, please make sure that you have registered for that webinar. Now, I also want to highlight that in preparation for next week, you will need to print out some materials before the webinar. So it's not a lot, but there's just 3 two-page documents. So that's going to be a blank worksheet and 2 worksheets that have been tailored to manual tasks. You will see those when you go to the registration link for the webinar next week. They should be there under event materials. We will also be able to email those out to the participants for next week. So I would say we're coming to the end of the session. Now, I think we've got a few questions that have come through, so I'll just take a minute to have a look at those and get back to you very shortly on those questions. We might only have time, depending on the types of questions, for a couple. If I don't get to address all of them, I will certainly follow up after the webinar. So I'll just be a moment looking at those questions.
Hi, Michelle. Just to let you know, we do have a few questions. One of them was, does workplace health and safety offer any one-on-one support to workplaces to implement PErforM?
Okay, thanks. Well, yes, the answer is yes. Workplace health and safety, you know, we have regional offices across Queensland, and we are happy to offer one-on-one support to workplaces. However, it is a case-by-case basis, and it does depend on, obviously, the commitments and workloads of our regional PErforM trainers at the time. So one thing we might be able to do, for example, is go along to the workplace for their first in-house training session. So if an organisation has put together a training session for their work teams, we could come along and help facilitate that session. We really, you know, wouldn't see our role as certainly not being like a consultant, but we just want to go and provide that assistance and then help the workplace to get started so that they're able to sustain the program.
Great, thanks for that, Michelle. We've just had a general comment come through as well, which is great. Just saying, workers in a workplace where I once worked stated the PErforM risk assessment tool was 100% easier to use than the old 8-page one that the company was using at the time. So that's great news. Thanks for passing that one on. Also, we've had another question come through. How do we order the resources and DVDs, etc.?
Those resources are all available on the website where I showed you, and I think the quickest way to get them would be to go to our Workplace Health and Safety website and download them. So you can download them and save them onto your computer there. If you are having any trouble accessing them, you need to get in touch with us, and you can send us, get in touch, and that message to contact Workplace Health and Safety email will come through to me, and I'll be able to help you get in some of those resources. The film is available on the website, and if you go to Hazardous Manual Tasks, Resources, the film is there under the video heading. So the Big No Sprains, Big Gains DVD or film can also be downloaded off our website as well.
Great, thanks Michelle. I've also just had a couple of comments come through just saying can I get a copy of the link to the PowerPoint and any printing, as well as registering for the sessions and about getting the content for the next one. I can just say that the PowerPoint will be sent in a follow-up email today, so you don't need to worry everybody. You'll be able to see the PowerPoint from today. It's also being recorded, so there should be a session placed online for you, and it will also be sending out the registration links for the other 2 workshops along in the follow-up email. So thanks, and just back to you, Michelle.
Okay, well I think that's it for our session today. Before you go, I just want to say this is the first time we have run this workshop as a webinar, so I know this is the one of a 3-part series, but look, we really welcome your feedback. It is so valuable in improving the future events. So please complete the survey that'll pop up after the webinar. And I'll look forward to joining you next week.